Good morning, Alex and friends. I'm Grace. Today is Friday, February 21st, 2025, and you're listening to Alex's News. The weather in Riverside will be mild today, with a high of 76 degrees and a low of 57.5 degrees, perfect for outdoor activities. Coming up, we'll examine the potential impact of Trump's proposed National Institutes of Health budget cuts on America's research landscape. Then, we'll explore the challenges facing California's ambitious new fuel regulations and what's causing their implementation delays. Finally, we'll investigate the concerning resurgence of measles cases in West Texas and what health officials are doing to address this public health issue. All this and more ahead on Alex's News. Stay tuned. We begin with a developing story in the world of medical research funding that could impact countless Americans. Joining us now is our science and policy correspondent Ethan Parker with details on a major legal battle over NIH funding cuts. Ethan, bring us up to speed on what's happening.
Thanks, Grace. A federal judge in Massachusetts is currently weighing whether to extend a temporary block on what many are calling dramatic cuts to National Institutes of Health research funding. According to the Atlanta Journal-Constitution, these cuts would specifically target what's known as indirect costs, essentially the administrative and facility expenses that research institutions depend on.
Can you break down exactly what these cuts would mean in practical terms?
Certainly. The Trump administration is pushing to cap these indirect costs at 15% of grants, which represents a massive reduction. To put this in perspective, The Lantern reports that Ohio State University currently operates with a negotiated rate of 57.5% and stands to lose between $47 minus $49 million in federal research funding. Other major institutions would face similar impacts. Harvard currently receives 69%, Yale 67.5%, and Johns Hopkins 63.7%.
Those are significant differences. What's being done to challenge these cuts?
According to recent reporting, 22 states and various research institutions have filed a legal challenge, which resulted in U.S. District Judge Angel Kelly issuing a temporary restraining order just 11 days ago, on February 10th. The administration argues that the NIH has the authority to modify grant terms, but researchers and institutions strongly disagree.
What about the potential impact on medical research itself?
That's where this gets particularly concerning, Grace. Scientists interviewed by hometownstations.com warn these cuts could endanger patients and slow down critical research. We're talking about vital studies in areas like Alzheimer's, cancer, and heart disease. Emory University projects, they'd lose about $140 million annually, and the University of Wisconsin has indicated they might need to terminate some ongoing clinical trials.
And what's the administration's rationale for these cuts?
The NIH estimates these changes would save $4 billion annually. However, critics argue this represents the most dramatic shift in NIH funding since the budget doubling period of 1998 to 2003, and the potential cost to medical advancement could far outweigh any financial savings.
Thank you, Ethan, for that comprehensive breakdown. We'll certainly keep following this story as it develops. This is story 1 of 3, and we'll be right back with more news after this break. In environmental news, California's ambitious fuel standards have hit an unexpected roadblock. We turn now to our environmental policy reporter Chloe Martinez for more details on this developing story. Chloe?
Thanks, Grace. According to Cal Matters, California's Office of Administrative Law, or OAL, has just rejected proposed amendments to the state's low-carbon fuel standard. This decision came down yesterday, and it's causing quite a stir in both environmental and economic circles.
Can you break down what these proposed changes would have meant for Californians?
The amendments were quite far-reaching, Grace. As reported by the Press Democrat, they would have increased carbon intensity reduction targets from the current 20% to 30% by 2030, with an ambitious goal of 90% reduction by 2045. The rules also included new tracking requirements for feedstock and would have limited credits for certain types of diesel fuel.
There's been a lot of discussion about the potential impact on gas prices. What are we learning about that?
That's actually one of the more controversial aspects. Initially, the California Air Resources Board, or CARB, estimated these new standards could increase gas prices by 47 cents per gallon. However, they later withdrew that estimate without providing new numbers. For context, the original 2011 standards only added about 8 to 10 cents per gallon to fuel costs.
How are different groups responding to this rejection?
It's creating quite a divide. Republican legislators are celebrating the decision, while environmental advocates argue these rules are essential for meeting California's climate goals. The rejection means CARB now has 120 days to revise and resubmit the rules.
What happens in the meantime?
The current fuel standards remain in effect while CARB works on the revisions. What's particularly interesting is that California's carbon markets have shown significant price volatility since yesterday's announcement. It's worth noting that while California's gas prices have historically been higher than the national average, studies show this is primarily due to crude oil costs and refiner pricing policies rather than environmental regulations.
And what's the next step in this process?
CARB will need to address the OAL's concerns about clarity in the regulations. If they make substantial changes to the original proposal, they'll need to open another public comment period before resubmitting. They have until June 19, 2025, that's 118 days from now, to get this done.
Thank you for that comprehensive report, Chloe. We'll be following this story as it develops. Here are some other headlines. French President Emmanuel Macron has issued a stark warning to former President Donald Trump, stating, "You can't be weak in the face of Putin." Macron described Russia as an existential threat to Europeans, emphasizing the need for a firm stance against Russian aggression. In Germany, over 500,000 newly naturalized citizens will cast their votes for the first time in this Sunday's federal election. Many of these new voters, who came from countries like Syria, Afghanistan, and Iraq, express both excitement and concern about their role in shaping German democracy, particularly given the rise of far-right parties. Following Senator Mitch McConnell's announcement that he won't seek re-election in 2026, a heated race for his Senate seat is already underway in Kentucky. Former Attorney General Daniel Cameron has announced his candidacy, while Congressman Andy Barr has expressed interest, setting the stage for what could be a contentious Republican primary. In environmental news, Mauritania faces an escalating crisis as the Sahara Desert continues to encroach on homes and historical sites. The expansion threatens UNESCO-listed towns like Chinguetti and Udain, while also impacting local communities and ecosystems. The country is participating in the Great Green Wall Initiative, a Pan-African project aimed at combating desertification. And in healthcare news, reports show Dr. Mehmet Oz holds millions in investments from companies he would oversee if confirmed as head of the Centers for Medicare and Medicaid Services. His portfolio includes significant holdings in major healthcare companies like United Health Group and HICA Healthcare, raising concerns about potential conflicts of interest. Dr. Oz has pledged to divest from these holdings if confirmed. We turn now to a developing public health situation in Texas, where a measles outbreak is raising serious concerns. Joining us with more details is our health correspondent Ethan Parker. Ethan, what can you tell us about this outbreak?
According to WESA's latest reporting, we're seeing a significant measles outbreak across West Texas, with 58 confirmed cases spread across several counties. The epicenter is Gaines County with 45 cases, followed by Terry County with 9, Yoakum County with 2, and single cases in both Lubbock and Lynn counties.
Those numbers are concerning. What do we know about the vaccination status of these cases?
NPR's analysis shows that only 4 individuals, or about 6.9% of the cases, were vaccinated. The remaining 93.1% were either unvaccinated or had unknown vaccination status. What's particularly alarming is that Gaines County, where most cases are concentrated, has a kindergarten vaccination rate of just 82%, well below the CDC's recommended 95% threshold for community protection.
Can you explain why that 95% threshold is so important?
Certainly, Grace. That threshold is crucial for what we call herd immunity. According to data from KNKX, when vaccination rates fall below 95%, it creates opportunities for the virus to spread more easily, potentially threatening our country's measles elimination status. In fact, Gaines County has one of Texas's highest vaccine exemption rates at 14%, compared to the state average of 2.32%.
What about adults? Should they be concerned about their vaccination status?
That's an excellent question. Based on current CDC guidelines, several groups should pay attention. If you were vaccinated before 1968 with the inactivated virus vaccine, you should get at least one dose of the current live attenuated vaccine. Those born before 1957 typically have natural immunity from childhood exposure. However, certain high-risk adults should get a second dose, including college students, healthcare workers, those living with immunocompromised individuals, and international travelers.
Are there particular risks for adults who contract measles?
Yes, and they're significant. Adults over 20 face higher risks of complications, including pneumonia and brain swelling. Dr. Paul Offit from the Children's Hospital of Philadelphia has pointed to a sobering example from 1991, where a Philadelphia epidemic resulted in 1,400 cases and 9 deaths. The good news is that the MMR vaccine is highly effective, with 2 doses providing 99% immunity in children.
Thank you for that comprehensive report, Ethan. We'll continue to follow this developing situation. That's all we have for now. Today's episode was made by Alexander King with Claude Sonnet 3.5, Gemini Flash 2.0, the Perplexity API, and the Google Cloud Text-to-Speech API. I hope you have a great day. I'll see you tomorrow, Alex.